The AHA board has spent the last year developing a new policy framework to follow on the Affordable Care Act and to keep pushing health reform forward. And it really focuses on two things: improving and strengthening accountability to patients, accountability to communities, and to those who pay for care, so that they know exactly what is being delivered, they know what the cost is, and they know what the outcomes are for each provider that they interact with. And the second is to use healthcare dollars wisely. Those dollars are limited. We know that. And we know that we have to get the cost of care down. So we want to be sure that we're only providing appropriate services. We want to be sure that we're utilizing services in the most efficient way and moving the patient through the care experience as efficiently as possible. So those are the two main drivers of our focus going forward. 2013 is going to be a critical year, certainly nationally, because it's the year in which we get ready for the expansion of coverage that's contained in the Affordable Care Act. It's also a year in which we're rolling out a lot of changes, or at least experiments and demonstrations in payment and delivery system reform. Nashville is in a key position with all of the different aspects of healthcare housed here, and the potential for collaboration to figure out what those changes should be and how they should work best together across the provider realm, the supplier, farmer realm, the payer realm. I can think of no place better than Nashville to have those kinds of roundtables and discussions about what all stakeholders can do to make for a better healthcare system.
High-quality, innovative care is really at the core of our belief that good quality is good business. What's not necessarily obvious to all is that good quality is also more efficient. I want to tell you about two things that we're working on, innovative and really aimed at improving the quality and value of healthcare. First is clinical excellence. It's a dialogue with physicians to use evidence-based practice with the goal of really creating a greater engagement driven toward improving patient outcomes and using precious healthcare resources most responsibly. The other approach that we're using is big data. We're blessed with a lot of clinical information. That information allows us deep insight into improvements in care, improvements in efficiency, all of which lead to better outcomes for patients and more efficient business operations in the delivery of healthcare. Nashville has the opportunity to be a major influence in healthcare during 2013. The nation's healthcare is changing, and Nashville is really a hub of innovation in healthcare. So change favors the Nashville environment in incredible ways. The intellect, the deep bench of skill in this community really will help to be a driver for the American dialogue on improving the quality, safety, efficiency, and even the compassion of American healthcare.